Well, about 5 years ago, 5.5 years ago now, the COVID-19 pandemic had us glued to our screens, hoping to learn more about how infections were spreading. A University of Regin researcher is hoping to improve how that is predicted using artificial intelligence. Affan Shoukat will lead a team in Canada and France that received 2 research grants. He's an assistant professor of data science and an adjunct professor in computer science. And Affan joins us now to explain more. Good morning.
Good morning. Thanks for having me.
You're very welcome. So what made you want to look into using AI to help predict infectious disease modeling?
Well, let's begin with what a model is quickly. Models are just tools that we mathematicians use to help us understand what happens in the real world. And we have our established set of mathematical tools that we've been using for a while now to help understand infectious diseases, the spread of infectious diseases, how it impacts the population, and so on and so forth. Except outbreaks move fast sometimes. And so, for example, we saw this with COVID. Of course, our behaviors changed, our interactions changed with each other. New variants emerged, all of which had different characteristics, different transmissibility, different lethality, severity. Vaccines came. That also changed the infectious profile of the disease. And so outbreaks move fast. And our goal now in my research lab is to combine artificial intelligence with our traditional models. And the reason we want to do this is we want to be able to capture these fast. When an outbreak moves fast, we want to be able to adapt our models in real time or as quickly as possible. The issue with our traditional models is that as new information comes along, we have to refine the model, create new equations, run our simulations. And by the time we go through all that, the outbreak has moved on, and the information that we're getting out of our models may not be very useful to public health agencies and decision makers.
So how timely is something like this? You mentioned we're on the heels of the pandemic, but people still want to track this, and there's infectious diseases all over the world that are spreading at different rates. Just how necessary is something like this to try and come up with a model that predicts things more on the fly, faster, and gives public health agencies and countries more predictability?
Well, if we can spot something earlier, if we can spot trouble earlier, we can react earlier. And so the goal of the research is to create models that can absorb or ingest information as quickly as possible and somehow give us early warning systems or signals that there's an emerging threat. And that allows decision makers and governments to react rather than, or to create policies that are preventive instead of reactive.
What do you enjoy about this, Affan?
Well, this is something I've been doing for a very long time. During my PhD, I started doing infectious disease modeling. And then, of course, as I graduated with my PhD, COVID hit. And so I've been in this world for the last almost a decade now. And it's great. I think I love doing work that makes a real-life impact. My work can sometimes, well, not sometimes, most of the time can help decision makers create their policies. I usually interact with Public Health Agency of Canada and other provincial agencies to inform them of what's happening on the ground.
What's it like to be able to team up with other researchers from here in Canada and in France?
Yeah, that's interesting. The federal government the last federal government had this program where we had a collaboration, and it's called an NSERC Alliance grant, and it was a grant based on a collaboration in France. And so I have a team of researchers in France that we'll be working with to create our AI-driven models, essentially.
Sometimes with numbers, people can get intimidated, and it's a lot of data that's coming at you. And we hear so much about how artificial intelligence may be the next wave. It can help in many different ways in our lives. Why is it something that you wanted to tackle? Is it something that's just necessary with the work you're doing?
Yeah, I think at this stage it is necessary to bring in these sophisticated tools into our traditional modeling world. And the reason is that we just have more computing power. This was not possible 10, 15 years ago. But with the amount of computing power we have and the amount of resources we have now, it's which is why you're seeing this hype of AI everywhere.
And for yourself here in the province and in Regina, is there sort of a balancing where you can use this in your research, but also bring it across the world? Like you're someone that's doing something here, but this could be used by anyone, anywhere.
Yeah, so a big part of my research is the translation of our scientific research into into outcomes and how decision makers can use those to sorry to inform decisions. And so some of my work has not only informed agencies in Canada and helped make decisions here, but also in the U.S. And Europe. Especially during COVID, we published a lot of work that was not applicable in Canada only, but applicable globally.
Affan, best of luck with the research and with the partnership with folks here and in France. Thanks so much for joining us.
Thank you.